yet the impact of HIV/AIDS remains alive in our communities, coupled with the stigma that accompanies it. We are also aware that it is our friends of goodwill who continue to support us. The Americans are doing so, and we have to appreciate them. But the question is, for how long will they continue to support us? The UN, in which we are a member but contribute very little, is also supporting us. So there is a sense in which we are in a crisis. Those who come in to support do so on the assumption that their contribution will be time sensitive, and when they come in in the hope that they have an exit strategy. But several years down the line, we now know that even our friends of goodwill are getting fatigued, even if they don't say so. And even if they say so mutedly, but we know that they are getting tired. And the time is now that we in the African continent must begin to look inwards. We cannot be a continent whose greatest claim to fame is begging. That cannot be the thing that defines us. Many times I imagine to myself that if our public officials, right from the president to ministers, visit the Chinese, the Americans, the British, and others, even when you begin a conversation, they must be asking themselves, but when will they begin begging? That is the reality. And the time is now that we must liberate ourselves from that curse of begging. And that is why I understand that this conversation this morning is beginning to ask the right question. Not that we have never asked this question before. Those of you who are students of things that happen in Africa will remember that as early as 1980 in Lagos, Nigeria, African heads of state sat under the Lagos Plan of Action. And if you look at the fine print of the Lagos Plan of Action, one of the things that preoccupied the continent at that time is how can we begin to engage with each other so that we are capable of solving our problems as the continent of Africa. Several years down the line, we are not far off from where we began. And one would say that perhaps the Lagos Plan of Action was not as targeted as it should have been. In 2001 in Abuja, under the Abuja Protocol, African heads of states and government once again made a commitment that the continent of Africa, each country in the continent of Africa, would dedicate 15% of their budget for health. I can report to you that not a single African country has reached that. Perhaps statistics show us that Tanzania tried, that Botswana tried, that Seychelles tried, that Mauritius tried. But the truth is, very little money is dedicated to our health departments, with the consequence that in areas such as HIV/AIDS, if you go to almost all African countries, the support we have is heavily skewed, and it is through donor support. I'm told here in Uganda, over 80% of your budget is covered by donors. And other African countries not shy of the 80%. And I can tell you that if it is supported in that manner, it cannot be sustained. Because the truth be told, he who pays the piper calls the tune. Still makes sense. The truth be told, there is no free lunch. Even when we are supported in those areas, there are always strings attached. The strings may be invisible, but they are there. And the time is now for us to smell the coffee, as the cliche goes. But sometimes I suspect in Africa that even our sense of smell is dead, so that we are incapable of smelling that proverbial coffee. And the time is now for us to ask ourselves, how can we liberate ourselves from this dependence? I know you are worried about Uganda, but Uganda cannot exist in spite of the region, because HIV/AIDS is not constrained to the borders. What happens in the Democratic Republic of Congo and the movement of peoples will affect what you are doing here in Uganda. You cannot ignore what is happening in South Sudan. You cannot ignore what is happening in the region as long as we are mobile. And if we thought that you could control it within Uganda, I see the Ugandans are making promises to themselves, and I do not begrudge them, that by the year 2030, HIV will have been eliminated. Have you talked to the Kenyans? Have you talked to the South Sudanese and the Burundians and the Rwandans that they are doing the same? If you have not had that conversation, that is a hollow promise. We'll sit here in 2030 and you'll once again promise to eliminate it in 2060. And I'm therefore suggesting to us that in as much as we are looking at the Ugandan situation, it is important to ask ourselves, and what are we doing in the East African environment? East African ministers for health meet occasionally. One would want to understand the kind of conversation that they engage in. One would want to understand the conversation that the African ministers of health engage in when we are talking about HIV and AIDS. The Uganda AIDS Commission is positioned strategically in the office of the president, and my understanding of it is that the presidency in this country has recognized that the impact of HIV/AIDS is not only in the health sector, and that it has an impact of an economic kind, it has an impact of a political kind, it has an impact of a social kind, and that therefore the president is saying, I want to have a bird's eye view of this particular scourge and give it the kind of prominence that it deserves so that we are able to fight it. And that is what begs and legitimizes the conversation that we are engaged in this morning. How do we deal with the question of funding? But before I come to funding, I was talking about the regional perspective of it, because funding must also have a regional perspective. I've already mentioned the Abuja Declaration on how we made commitments to ensure that 15% of our budgets are dedicated to the health sector, and therefore by extension HIV/AIDS would also be on radar. What about in the African arena? Many of us are familiar with the African Health Strategy. If you look at the Africa Health Strategy, it tells us that the current version of it, I think, is between the year 2016 and 2030. And the whole idea is that we want and have devised strategies that are going to ensure that we reduce the disease burden. Because if we reduce the disease burden, then we are releasing funds which could then be deployed in other areas which would improve the quality of our people's lives. And if the continental idea and the continental strategy is therefore to ensure that we improve the health sector, what are the structures that are there which are also relevant to the funding arena? Those of you who are doctors will know that we now have centers for disease control, with the mother center based in Addis Ababa, Ethiopia. The rest are distributed. I think one is in Nigeria, the other one in Kenya, the other one is in Gabon, and the other one in Egypt, 5 in total. But who is funding all these things? If you look at African institutions and African initiatives, they are all externally funded up to the extent of 80%. So they are African only in name, but the funding is from outside. And that is why this morning we are wrapping our minds around how we can tackle the question of funding, how we can liberate our donors, because there is a sense in which our donors have also become enslaved by our own lethargy and our inability to release ourselves from dependence. How can we have a strategy where we will transition? Those of you who are mothers will agree with me. If you have a child who upon being born suckles, as he or she should, but at age 40 they are still suckling, you must be very worried about that child. Because that is a sustained state of childhood which must not be allowed. Africa is such a child. At 40 we are still suckling. We must now be weaned off the breasts of our donors. And we are asking ourselves, how are we going to do it? What are the different methods? I am informed that in Uganda, your parliament in its wisdom made a decision to create a HIV/AIDS trust fund. That was several years ago. Africa is never short of good intentions. Africa is never short of good laws. In fact, in Africa, there is a forest of good laws which are honored in breach. So one of the areas in which you could begin talking about populating that fund with money is to activate that fund. Because if you activated that fund, and there are different models, I believe that the private sector can be involved. If you gave reasonable tax incentives, you are now talking about your oil. It could be that out of the revenues that you are going to generate from that oil is going, I'm told your oil is your beginning production in the year 2025, God willing. And if that does happen, then how do you use some of the resources from the oil revenue? What about the levies that are imposed? One of the areas I'm informed that was going to be taxed are the sin tax. Those of fellows who have businesses which also have the potential of incubating or creating environments where HIV/AIDS can be contracted. You can impose taxes on them, bars and nightclubs and casinos. So that is one avenue. Simply activating the fund so that that fund is going to be available for purposes of addressing some of the issues that are confronting us on a daily basis. There are different models. I'm quite certain that if you talk to the private sector, the pharmaceutical companies, the CIPLA, for example, which I see is one of the organizations that is supporting you, what is it that the pharmaceutical companies within the region can do for the country? And within the region, there can also be a deliberate move by each of the East African countries, 5 in number now. If we donated just 5% of our budget, not our GDP, just the annual budget of each one of the countries into a regional fund to deal with HIV/AIDS, And President Museveni is a champion in this regard. You've got to urge him. Part of the problem that we have in Africa is that we don't sometimes even confront our political leadership. And let me tell you, if politics fails, everything fails, particularly in Africa. The problem is that whenever we have senior politicians in the room, the professionals just coil their tail between their legs, and what they engage in is praising those individuals, not saying the right thing. And I hope that when the Prime Minister was here, I hope you spoke boldly to the Prime Minister. You've got to learn, we've got to learn to speak boldly. These are human beings, they're just occupying offices, which you too can occupy. And if you speak boldly and firmly and respectfully, they are running countries, they want to succeed. And they want to succeed by doing positive things. And I want to imagine that the proceedings of this conference will find its way on the desk of the president, not the executive summary, because the executive summary sanitizes things. Let the president read the full-blooded deliberations of this particular engagement so that he is capable of appreciating that these are the areas, because how can it be that the program on HIV/AIDS is run from the office of the president, and yet the HIV Trust Fund is not established? When you are talking about the annual milestones, what do you tell the president? That for the last 5 years we have had an inactive fund? And how does he think about it? If the president is talking about the parish model, is the parish model not impacted on negatively by HIV/AIDS? So that money that ought to go into actual development is then not taken into that arena? I believe that this can be done. The other area where I think is important is that even the research institutes in this country, because research is at the very heart of it. You know, I do not know whether sometimes you feel the pain I do when I think about our countries and about our continent. There was COVID here, and we were all wearing masks. Those masks, 90% of them are from China. We are going through tests. The test kits are all from China. And we did not stop there. When the vaccines came, all of us were lining to be vaccinated. We do not know what we were being injected with. By faith, we just believed that it is good. And then we started complaining that we are not being given vaccines. Who should give us? Who owes us a duty? Why can't we produce our own? And I'm saying this because we must also fund research. Many institutions now in East Africa and in Africa, we have research departments. But if you ask many of those individuals who head those institutions, apart from the money that they are given to pay themselves salaries, there is very little money that is available for research. So our researchers have become proposal writing machines. They are either writing a proposal to USAID, CEDA Sweden, CEDA Canada. That is all we do. And if you write proposals for too long, you forget every other thing. You become an expert in writing proposals and delivering reports to Copenhagen or Oslo or Washington or London or Ottawa. Africa must stop that. Africa must stop that. The representative of PEFA will be speaking a little later. I would want to have a conversation with her. When are you leaving? Because she must leave. Because if she does not leave, then we are not going to grow. They mean well for us, but for how long? we keep them here? And that is what makes necessary to have a funding system that is going to be useful. And I'm talking about funding research, because when you fund research, you will also generate income. You imagine to yourself, and I was telling the good doctor, those who are in the business of innovating and creating the vaccine, they are laughing all the way to the bank. They have made money in the billions. Therefore, they can fund research. Vaccines, HIV/AIDS vaccine, we are waiting for Europe and America to discover. And meanwhile, we are conferring professorial titles on our research. For what? Professors of what? We must be bold and blunt, because it is through innovation and invention that we can also generate funds. I was alive when the ARV debate was going around, when India was defying all those things, when the Chinese were defining. I'm aware that some ARVs are made here in Uganda, which is a good thing. But when are we going to run our own pharmaceuticals and engage in research? Because it is the pharmaceuticals that are also giving funds that can support HIV/AIDS. So let us look at research and development as an avenue of generating funds, and therefore giving us the opportunity of liberating ourselves from the donor funding that we are depending on from the United States of America and other sectors. There are also innovative ways of dealing with this particular scourge in terms of funding. National health institutions, I know there are quite a number of them, where you ask people to pay money, but you utilize that money. The problem we have in Africa is theft. We have perfected the art of theft. We call it by its Christian name, which is corruption. It is theft on an industrial scale. The Christian name sometimes gives it a veneer of wit. But we are thieves. I do not know why. And we must stop being thieves if we are going to fund these initiatives. And this is very critical, because a lot of money is also lost through the thing that we call corruption. And you now see donors, for example, saying, we are not going to fund government. We are going to fund projects directly. And why do they say that? Because you give $10,000 to a governmental institution, 80% of it will be building a villa somewhere in Uganda, or building something somewhere in Nairobi. So they go directly. So we must also ensure that we improve efficient utilization of funds. But I was talking about National Health Institution in Kenya, National Health Hospital Insurance Fund. How are we funding this? In the Scandinavian countries, you find that taxes reach up to 52% of the income. Why? Because they know that the money is going to the right place at the right moment. If we were to establish national health insurance funds, and we were to strengthen them and to make contribution and to make the case for HIV/AIDS, which we desire to eliminate, then we could also create a funding avenue which would liberate us from donor funding. Which then begs the question, you practitioners who are here. Many of you are university professors. Some of you are practitioners in hospitals. Some of you are researchers. Some of you are working with communities. Today I want you to ask yourself very nagging questions. Suppose USAID were to make a decision tomorrow that they are leaving. Suppose PEFPA were to make a decision that they are leaving. Suppose UNAIDS were to make a decision that they are leaving. Then they have made such decisions in Afghanistan. They did. How would you survive? Have you ever thought about it? I want you this morning to think about that possibility. Because when you think like that, you will wear a cup, a crisis cup. And that is what I'm urging us to think and reason as if we are in a crisis of gigantic proportions, so that we begin to ask ourselves, how are we going to fill this void? And I'm suggesting that the time is now that we've got to look at domestic resources. I hope that one of the outcomes of this engagement is that the Uganda AIDS Commission will put together a working party of not more than 3. Africans are in the business of appointing commissions of 50 people who never want to finish because of allowances. A working party of not more than 3 individuals with a set time limit, whose only agenda is to ask, how are we going to liberate ourselves from donor funding? And the donors must also help us in this regard, so that there is a transition. USAID and PEFA must now give us a notice here in Uganda. Give us a notice that you are leaving in the next 3 years, and with no extension, 3 years. And help us in the process. And the process will also include us giving us a seed fund. Because the other problem with donors, they also want to keep us in a state of perpetual begging. That they never tell you. But I'm telling you now, they also love it when they keep us in that stage of dependency. So give us a seed fund, and you can afford it, of $50 million. And tell us, this is the seed money, begin using it and invest it in a manner that will be sustainable. But if you keep on telling us that we will be here for you, God sent us to be useful to you, we will never change and we will never grow. So there must be a transition period where you support us with seed money, and we begin to look at our tax regimes in order to fulfill this gap of funding. As I conclude, so that we enrich this conversation by way of cross-fertilization of ideas and thoughts, I am suggesting that fundings must come at various levels. In the first instance, it must be in the domestic arena. Uganda as a country, in the manner that we have already talked about, must find ways and means of ensuring that we are able to fund our activities, and funding those activities must be understood in the context of overall development. When we talk about sustainable development and we talk about the pillars on health, there is nothing that is going to happen unless we deal with HIV/AIDS. When we talk about Africa Agenda 2063 and the pillars on health, we are only going to talk about Africa Agenda 2063 if indeed we are going to have funding. So Uganda must have a Ugandan position. That Ugandan position must now be fed into the East African position. And I want to believe that there are Kenyans here, there are Ugandans here, there are Tanzanians here, and we must have meetings that are reporting meetings, because one of the other problems we now have in Africa are annual jamborees, symposia, and all these other things that we hold every year. And then you have a certificate and you lengthen your CV saying, I attended a conference in Kampala. That is useless. We are attending too many conferences, too many jamborees, which are giving birth to nothing. The next meeting must be a reporting meeting on what we have achieved, not scholarly papers. There's too many scholarly papers, refereed papers. Nobody is reading that nonsense. People are dealing with real issues on the ground. So we can amuse ourselves, we scholars, by writing peer-reviewed papers in journals. They don't care unless their lives are changing in the parishes. Otherwise, we are not relevant. So I hope that beyond Uganda, there is East Africa. Within the East African region, how do we raise funds? And I've already suggested the means in which we must do so. Beyond East Africa, we must have an African platform. African Union itself, as you know, is also another big beggar, the biggest beggar on earth. 80% of its budget is externally funded, even the CDC. I think the CDC in Africa is funded by the United States of America and modeled after the United States of American CDC. Can't succeed. This idea of mimicking Western institutions in the continent of Africa cannot succeed. And the sooner we realize that in Africa, the safer we are. But remember also that we must come with workable models that borrow from other civilizations. And this is why I like the Chinese, although they are not liked by many. The Chinese have demonstrated to us that you can borrow from Europe, you can borrow from America, and you build your own unique systems that work for you. The Indians have also done that. The Japanese have done that. It is only in Africa that we still are laboring under the misguided view that what Europe and America do is what is God ordained. Until we liberate ourselves from that mental slavery, we are going nowhere until the second coming canon. So in the African context, we must also have a model. And that model must go back to the Abuja Declaration of ensuring that we spend at least 15% of our budgets. So in a nutshell, I'm saying, Ugandan model to deal with the domestic arena, the East African model to deal with the East African region because HIV/AIDS is cross-border, the African model to deal with the African continent. It is only in that way, ladies and gentlemen, that we will make our supporters to support us with respect. There will always be support, and Europe and America owes us. Actually, they must be told. Sometimes we don't tell them. They owe us, but they must do so in dignity and in a sustainable manner. We must make support to us dignified. As I conclude, I want to ask you this question. If you run your household, you are a husband, you are a wife, you have children, you are adult males and females of sound mind, supposedly. And on a daily basis, the food that you consume in your house is shipped to you by a friend of goodwill. Do you think that friend of goodwill respects you? They may be polite to you, but do they? They don't. And should they? They shouldn't. I'm suggesting to you that until the day we wean ourselves, all these will continue to happen to us, and nobody is going to respect us. I'm now speaking to you, fellow Africans. Nobody. You may have your PhDs, you may have your professorships, you may have big titles, but when they go out in Europe and America and they sit in their rooms, I want to imagine to myself what they say. They'll soon be coming here on a begging spree. And even when you are holding a decent conversation, they are waiting for you to do what brought you, beg. Let us stop it here and now. God bless you. You may ask you such questions as you desire. Thank you very much.
you certainly have no option but to agree with me that Professor Pierre Lumumba does not disappoint. Thank you, Professor. He has mentioned many things, and I have no intention, not even a right, to repeat them. I just wanted to answer the question for PEFA. When are you leaving? 2030. Oh, Prof talked of 3 years. Don't leave this child before they breastfeed enough, because they will die. We have an agenda to talk about integration, strengthening systems. While we do that, we have people to look after. This conversation is about how do we sustain the response. And we don't want to abandon the response midway, but we also don't want to be breastfeeding at 60. Surely, really? It can't be. So how do we find the middle line? We're going to invite people here to have a conversation with us on these issues. And you're also part of this conversation that we're going to have. It doesn't start today, it has been ongoing. It doesn't end today, it will be ongoing. But we want to implement it. We don't want to have a forest of documents that say good things and we never do them. What happened to the fund shouldn't be a question we'll be asking tomorrow. No, we need to know the fund is active. So the conversation is going to be private sector, is going to be government, is going to be me and you, is going to be many, many of us. With your permission, I want to be allowed to invite Mary Bogman, I hope that's the name. I don't want to be taken to the new Senate. It hasn't been decided yet, so I'm watching that space, by the way. It speaks volumes to this meeting. The U.S. PEFA country coordinator with the U.S. mission. And in Uganda, she's done very many things. And before she comes in, like Professor did, I'm not going to get into the details of those things. She's here in her own right and capacity. And where she finds she needs to tell us more, she will tell us as we go along the way. Mary Bogman, you're welcome to the podium. Apparently, the slide to the top is sliding. So, but there are steps this side, but they are being covered by so many other things. I may want to have an intention to sue, because I almost fell there, but we are here for good intentions. And we have a mediator and a moderator in the house. Frederick Kakoza, hope that is the name. Wherever you are, find your way to the podium here. He's the Chief Finance Officer for Cipla Quality Chemicals Limited. 5 years of experience in finance and manufacturing. He's worked with other sectors, not just Cipla, which is a pharmaceutical world. So he's worked with energy, he has worked with the telecom, he's worked with pay TV. Fred has over 20 years experience in financial management. Welcome. We are hoping to listen to you. Has Paul Mwanja reached the venue? Oh, yes, Paul, why didn't I see you? I've worked with Paul in many areas, so he's one of those people who will come and tell us what I know about him. People in the phase of getting promotions, some through Twitter, some through many things. Paul may have been promoted last night, so I don't want to say what he was yesterday. Paul, why don't you join us here in this conversation? He comes in from the Ministry of Finance, and he will be telling us quite a number of things on how are we going to manage the transition. We are supposed to have had somebody from the Ministry of Health. I don't know whether Ebola has edged AIDS ahead of the competition. These are all diseases we must be dealing with. But sometimes we forget some and others pop up and we focus on them. but Ministry of Health will be ably represented in this conversation, because we are really not only in the health sector space, as Professor has mentioned, we are in the space of the President's office. These are matters for the presidency, because they cut across. So this conversation is going to go all the way. And I want to begin where I'm comfortable most, the private sector. We have designed ours as a private sector-led economy, and quite often, whenever these things happen and affect the private sector, they affect all of us, wherever we sit. They pay the taxes, they employ the people, they do the manufacturing, they do everything really. Private sector is like everything to us in this space. And the government has ably recognized that the private sector is a powerful force in sustaining the HIV response and many other areas, as I've mentioned, that are the drivers of our economy. And the government is strongly convinced that effective partnerships with the private sector are the way to go. Especially as we say, how do we sustain this domestically? We can only look up to the private sector. So what opportunities can be harnessed in the private sector in the HIV response? Mr. Kakoza. We need microphones here. And sanitize them, please. Hopefully you have there is a sanitizer next to him. And I hope you'll find us more so that they don't keep moving around, if you do have them. If you don't have them, the private sector shall provide them eventually. Mr. Kakoza. As the microphone finds its way on, it will definitely work.
Yes, it's working. Good morning. Thank you very much, moderator. The question is, how does the private sector contribute to the response to HIV? The private sector contributes in mainly three ways. That is awareness, access, and affordability. And in terms of awareness, you've seen areas in schools where posters are put up about HIV, HIV champions are appointed, and a lot of sex education happens, and the dangers of HIV and AIDS are spelled out to the young population. In the workplace, we've seen free HIV testing so that the knowledge is aware, everybody knows their status. And then also talks, usually corporate world, they invite professionals to advise them on how to behave and how to keep safe and away from the dangers of HIV. We've seen the mass media, and personally I listen a lot to CBS. I've had the Kaliso list of people. Every morning they make a message about HIV, and I think that's a very good contribution. I don't think they're paid for that. The other element is access. Usually the private sector makes access quite easy, because they are governed by profit. So they bring in as many as they think the market will need. And this access makes it available to those that would not have picked it up should it be only available to the government. We may pick some lessons from the COVID time. Remember, during the COVID time, supply chains were disrupted. And that disruption would have made it very difficult for people to access their HIV treatments. But our country has a strategic investor who is Zipla, who I happen to work for, and we're still able to avail all the 900,000 treatments for patients in Uganda. And this also helped other countries in Africa who were unable to give their own treatments, and so Uganda became a support to other countries. The other area is affordability. When you look at the total cost that the patient incurs, and you look at what they would have gotten it if it was gotten elsewhere, it is still cheaper to get it through here because the other complications of logistical requirements of getting the items here, storage, and regulatory checks would still be easier if we got the items here because all those elements increase the cost. So in a nutshell, the contribution the private sector does is generally around awareness, access, and affordability. Thank you very much.
Thank you very much. I hope we are taking notes of some of the things we really need to address as we go forward. If we are to sustain this domestically, logistical challenges really hit us hard during the COVID era. So we may want to have strengthening local capacity to produce some of the things, just in case satellites begin falling out of space, we don't have to have those disruptions fail us to access our drugs. Affordability and access are critical. I want to cross over to PEFA, and really you have signaled the transition rightfully and justifiably, I think. The several countries have been undergoing this. It's not just a case for Uganda. And Professor Lumumba said it should be a regional effort, really, because these porous borders of ours, we move at night and during the day, so Uganda can't just sustain it alone. So there are quite a number of things, and we have seen quite a number of challenges that have been faced by other countries who have transitioned on. So you have some quite of experience on this journey of transition. Question is, what approach are you going to use, and what advice do you want to give to Uganda during the transition?
All right, thank you, and good morning, everyone. So first, I'd like to make the distinction between transition and sustainability. So as we move into this next, really a refocus on sustainability, transition is a part of that, but it is not the full conversation. So during transition, generally we discuss financial transition, and this is much more focused on ensuring that functional responsibility shifts related to what was just discussed, and eventually that domestic resource mobilization then comes in. So what the timeline is, that is done mutually, and that's not a decision made solely by PEPFAR. It is in collaboration through respectful partnership with the government of Uganda, with civil society, our local partners that we've been working with for the past 20 years through PEPFAR specifically, and that we have appreciated that strong partnership. So we also understand that HIV epidemic control is dynamic, and we, as in the US government, the Global Fund, UNAIDS, the government of Uganda, local development partners, civil society must work together. There is no expectation that once a country reaches epidemic control that PEPFAR will be gone. This is a discussion and a mutual approach. So sustained impact is really a long-term, gradual process tailored to country context. And this is not, again, about the end of a program or the HIV response, but we do want to shift from looking at HIV as a silo or as a project. So a sustained response is focused on ensuring that person-centered and equitable services are accessible regardless of donor involvement. And this requires local health systems to be resilient and able to manage other public health threats, as we've seen with COVID-19, as well as the Ebola outbreak. So when you ask about the approach that's planned, PEPFAR's plan is to meaningfully engage with the partners discussed with government of Uganda, local partners, civil society, to ensure that there are best practices that are shared and that we move in this together. So this is really at every level. The Office of the Global AIDS Coordinator just released a draft 5-year strategy that I would encourage everyone to review. It's open for public comment, and so we want your feedback on that strategy. This is not something that PEPFAR is directing, but is really, again, done in respectful partnership. And we realize that sustainability is often viewed through the lens of transition, And though transition, again, is an important part of sustainability, we do not expect this to happen overnight. But together we can develop that clear roadmap that leads us through the next steps. And this is initially focused on the functional responsibility and the public health systems.
Very interesting statement there that the transition is going to be mindful of the sustainability and say conversation. But we know Ugandans like prolonging conversations. So we'll see need timelines on when do we finish which conversation, when does what conversation begin, and when do we finish the conversations and begin to implement the output of the conversations. Otherwise, we might come back and invite you in 2060 to see how do we sustain the transition. That will be 2060. Paul, you are the man in the Ministry of Finance. Some of these have financial implications. Some of them are conversations elsewhere, but they eventually end up in the Ministry of Finance. Everything needs to be implemented. And while we were thinking about this, which we began 4 years ago, we didn't know there was going to be COVID. We didn't know there was going to be Ebola. We didn't know there was going to be inflation rising from the seasons of the Americans and the other Europeans and the other people, and ourselves, of course. So where you sit, I can see a lot that is on the desk amidst this. Maybe we want to begin our conversation with you in the middle of all this. How do you intend to meet the expectations of this transitioning with sustainability, not just of the HIV response, but of the entire economy? But please take time to tell people who you are. I stole those records from you, and I didn't want to speak stolen information.
Thank you, Dr. Fred Muhumuza. My name's Paul Patrick Mwanja. I'm an Assistant Commissioner in the Ministry of Finance. Let me start by pointing out that in terms of Uganda's development agenda, the overarching goal is to increase household incomes and the quality of life of Ugandans. And there is no way you can improve the quality of life of Ugandans without adequately financing the health sector and having it functional. Now, in funding the health sector, we do welcome contributions from development partners because, as we all know, development partners tend to provide grants to government, which is a good thing, but we know that these grants are temporary. So I do agree with Professor that as we move forward, we expect these donor resources to decrease, and this is partly because of emerging priorities like climate change that will need to be funded, as well as donor fatigue, as Professor ably pointed out. That's why for government, we have progressively moved towards reducing dependency on donor funding for the health sector. Between 2018-19 and to date, funding for HIV/AIDS from government coffers has more than doubled, increasing from 97 billion to 197 billion. Now, I do note that we are yet to confirm to the Abuja Declaration that recommends a 15% threshold of the budget for the health sector, but we are committed to gradually increasing funding for the health sector towards that target, resources permitting. So how does Uganda, therefore, intend to look inwards as a means of reducing dependency on donor resources for funding the health sector. The number of things that we are looking at, besides creating more space in terms of the portion of domestic revenues that we commit to the health sector, one of which is health insurance, which is high on the legislative agenda. We think that is a big opportunity that we can use to supplement resources to replace the exiting donor contributions. The other area is public-private partnership with our entrepreneurs. We have CIPLA that is doing a great job in manufacturing drugs that we feel are cost-effective, and partnership with our private entrepreneurs by guaranteeing demand and financing for that demand would go a long way towards occupying the space that is expected to be left by the development partners. There is the issue of the need to have a health financing strategy where you focus on reducing the disease burden. This was pointed out by the professor. The Ministry of Health is emphasizing preventive Medicare, and I think that is one area where we think fiscal space will be created as we spend less on the lowering disease burden. The professor did mention the issue of the trust fund. Good idea, but from our view, it's an inefficient way of managing public resources because it comes with administrative structures, and in the past, we've seen abuse of such funds. We have the story of the Global Fund that we had in 2003. So it's a good idea as long as we work on measures to improve efficiency so that we eliminate the possibility of misappropriation of funds that comes with the existence of such funds. So in short, government is committed to devising means of increasing the health budget as we prepare for the exiting development partners. But for this to happen, we need good information on the exit plan. And I also agree with the professor that we need to have in place a national strategy, a comprehensive national strategy, and the need for commitment to regional arrangements, which are a good platform for mobilizing resources for this cause. And we are very strong in the partnerships within the East African region and the African Union, and we look for ways of strengthening those collaborations. I thank you.
Thank you very much. Paul Mwanja is here to represent the Permanent Secretary and Secretary to Treasury. So everything he says should be taken to that level, because he's been briefed from there, and he has briefed there, and that's our positions for the conversations that we are going to be engaging with the partners on what is the best way out. We don't want to lose the aspect of sustainability even as we transition. I think sustainability is going to be key, sustaining the response, making sure we do not lose out on the gains we have made, and there have been big gains, especially for Uganda, since the president personally took over this responsibility of the HIV response. There has been talk about health insurance, and quite often health insurance speaks to the private sector, because that's where we are looking to say, can you provide some insurance? And I know when you look through the insurance records, medical insurance has been growing. So how do we bring in, tap into part of that thinking and part of that activity and part of that resource to sustain the HIV response going forward? So I'm back to Mr. Kakoza. As private sector, you have had conversations to do with health insurance. It's still high on the legislation. We don't know whether you are in support or not in support. The conversations are ongoing, and how you intend to really perceive and receive and support the conversations on health insurance. So how can really the private sector through the health insurance increase the response? Speak to that space of health insurance and this response to HIV.
Thank you very much, moderator. There are not many medical insurance schemes that encourage HIV. And usually they make it a bit, the premium goes up. And I think the first thing is to have some regulation around there. That regulation would be quite important because it would open the space, it would increase certainty, and it would also encourage the other people investing into that space to put more resources there. Once that is done, then the overall burden of the cost of the patients would significantly come down. So I think regulation would make things much easier. There may be other models which I'm not aware of in other countries how they manage this, but I'm sure there's something to learn from in the outer space. Thank you, moderator.
Thank you very much. And I think one of the rejoinders that Paul has raised is the cost of administering the system. From what I have read, there was a component of managing the health insurance system and which was introducing in an administrative cost. Maybe some of these are conversations we want to discuss. If there is a model where it can be managed along with the others, maybe we'll have those conversations. We don't want to raise money and it goes into an administrative structure. But that said, we also have civil society engagements, and I want to believe PEFA has been very actively supporting civil society. So even as we talk about these conversations of transitioning, of sustaining, they must be out there having conversations with you. Maybe you want to speak to that space. What conversations are you hearing from civil society? What concerns? What is the way forward? How do they come in before they go out? Because they must not go out. Thank you.
Okay, thank you, moderator. So there are ongoing conversations with civil society, and this is where we come back to person-centered, equitable services that are available to all, including